Hi everyone. Today in this video you'll be watching, I'll be discussing healthcare environments in relation to hand hygiene within healthcare. But before that, I would like to give you an idea as to who I am as a person. I recently just graduated from the year of 2017 from Arthur Phillip High School located in Parramatta. I'm currently undertaking a nursing course at Western Sydney College within Nirimba campus, and I'm in my second semester as of right now. My background comprises of Samoan, Chinese, and German, and I was born in Australia at Fairfield Hospital, New South Wales. And finally, I love every and all foods, so I'll be grateful for any form of food. Alright, enough about me. Moving on to what I'll be covering today is as you see displayed before you, which is overview of hand hygiene in healthcare environments, statistics of hand hygiene, when hand washing for optimal hand hygiene is to be performed, risks associated with poor hand hygiene, cleaning products utilized within healthcare environments, other aspects of hand hygiene, and procedure of hand washing in healthcare environments. Alright, now to begin with is the overview of hand hygiene in healthcare environments. Optimal hand hygiene is both an essential and effective measure in relation to the minimization, if not prevention, of illnesses or diseases spreading. Its prioritization is vital as hand contact is the most common form of harmful microorganisms or bacteria being passed to another. This is primarily the case in healthcare settings due to healthcare workers being subjected to numerous hands-on tasks with their patients. If their hands are not clean, simple activities such as placing a finger in the mouth or rubbing the nose or eye may transmit enough germs in the body to cause infection. The National Hand Hygiene Initiative (NHHI), implemented by the Hand Hygiene Australia (HHA), data shows that the compliance rate of hand washing within healthcare environments of Australia by the end of 2017 was 85% in comparison to the rate of 60% during the year of 2009. This highlights the importance and value of proper hand hygiene among health professional areas, increasing both their own and their patients' health as well as their surroundings. On that note, the application of hand washing for hand hygiene in a healthcare environment is required in 5 moments comprised of before contact of a patient, before an aseptic of cleaning task, after body fluid exposure risk, after contact with a patient, and after contact with patient surroundings. The administration of this plan is to ensure the protection of the healthcare profession/worker, patients, and the surroundings from undesired harmful pathogens and in effect promote a healthier healthcare environment. Individuals who do not perform hand washing are at health risks, which trickles down to the rest of the surroundings. This is more perceptible within healthcare environments as any form of physical contact, for example handshaking, influences illnesses or disease to surface or spread, contagious ones, an individual is already diagnosed with. This consists of a variety of respiratory illnesses ranging from the common cold, influenza, chickenpox, meningitis, food poisoning, gastroenteritis, diarrhea, pneumonia, trachoma, skin infections, and many more, which can devastate the outcome of one's overall health and life. An additional repercussion correlated with poor hand hygiene involves germs taking residence within the environment in the form of doorknobs, tables, and medication. Hence, expansion of exposure to germs takes place, creating more problems for both healthcare professions, colleagues, and patients from a health issue standpoint. Cleaning products are incorporated to help facilitate with hand hygiene, such as soap dispensers, hand drying machines, or even paper towels. The existence of these cleaning products are necessary, as water is not enough to dispense of all the dirt on our body, let alone the germs/bacteria that remain. In that sense, the soap dispenser plays a key role in eliminating all the germs when mixed with water. Moreover, hand dryers and paper towels are used to then rid our skin and hands of the remaining germ-intoxicated water, hence why most healthcare environments garner such services or devices for the benefit of everyone within. A notable, if not the most important aspect of optimal hand hygiene is that maintaining high levels of practice or application of hand washing allows for it to come to pass. If this simple yet taken for granted task is not met, the endangerment of everyone is present as illnesses and diseases may increase, which is the polar opposite of what is to be achieved within the healthcare environment. So here I have displayed the hand washing process using water and soap, and it should take around 40 to 60 seconds. So it is 1. Once your hands are wet, apply soap to cover all of your hand surfaces. 2. Rub hands palm to palm. 3. Rub your palm up and down the back of the other with interlaced fingers and vice versa. 4. Rub palm to palm with your fingers interlaced. 5. Rub the backs of your fingers to opposing palms with fingers bent and interlocked. 6. Rub your left thumb clasps in your right palm and vice versa. 7. Rub your clasped fingers in the backwards, forwards, and rotational direction in the other hand. 8. Rinse hands thoroughly with water. 9. Dry hands thoroughly with a single-use towel. 10. Use the towel to turn off the faucet. 11. Use towel to open door. 12. Once everything before this step has been met, chuck the paper towel in the rubbish. And 13. Your hands are clean. Alright, now to sum up, optimal hand hygiene is pivotal in the prevention of illnesses or diseases being spread, as hand contact is religiously taking place within society and is even more prevalent within healthcare environments. Following the simple procedure I have provided you before will ensure your health and others, including the environment, are secured from any pathogen spreading and thereby minimize, if not prevent, illnesses or diseases occurring. That concludes my presentation, and I hope you have a deep understanding of the importance of hand hygiene in healthcare. Thank you.